Today, you join us for our next episode of our local business spotlight, where we're here at Takeley Chiropractic talking to the owner Scott and massage specialist Heather. Make sure you watch until the end as well for a special surprise. So I'm here with Scott. Thank you for having me, and obviously having us over to have a chat with you. For those that aren't, familiar with you guys, I know you guys quite well, having been here for a number of years. What is it you guys do? Is it just chiropractic work, or I think you do kind of sports massages and other bits?
Yeah, great to have you guys. So we do a number of things. So chiropractic, sports massage, acupuncture, ultrasound, cupping's going to start from August as well. So it depends what's needed, really, but a variety of approaches can be taken. Yeah.
And in terms of the approaches, is that something that you would essentially determine when someone comes in, and you can then advise on, what would be the best process?
Absolutely, yeah. You've got to tailor it to the individual, to be fair. I mean, two people can have back pain. One might be sort of overuse or strain. One might be chronically weak core muscles.
Yes.
So we need to approach them differently, or both might have similar symptoms to start with. So that's where your detailed analysis will come in handy.
Yeah, I know you mentioned if someone's got, back pain or something, is it just if someone's got, an ailment or an issue that's kind of going on with them, they should come to you, or is it best to come regularly?
Well, I mean, I guess primarily most people will come because they've hurt themselves.
Yeah.
But once you've got them out of pain, a lot of people choose to kind of maintain the benefit, so they feel better. But like a car, it'll get a service every once in a while.
Yes.
It might be just 4 times a year, but it seems to prevent a lot of flare-ups, depending on the nature of their job and how active they are as well.
Nice. Because I always thought, before I came to you guys, I thought, chiropractic is just going to be lots and lots of clicking. There's not really going to be much else to it. It's going to hurt.
Yeah.
That's not really the case, is it? For people that haven't.
No, not at all. There's, I suppose the manipulation or adjustment is similar to hearing a click sound, which is just tension releasing. It's a bit like having one of those suction things you put on the tile in the bath and make a little pop sound. So it's just a pocket of air being released, to be fair. So it's completely safe, completely harmless. There are more gentle sort of maneuvers as well. So we call them mobilizations. So that might just be pulsing the joint backwards and forwards. So it depends how old you are. If you've got some osteoporosis or osteoarthritis, you have to tweak the treatment accordingly as well.
Is this the kind of profession you always wanted to be in, or did you kind of fall into it? Or
no, I started life with a chemistry degree, weirdly enough. So I think I was going more pharmaceuticals.
Yes.
But over time, it wasn't for me. Being in a fume hood on my own all the time.
Yeah.
I got distracted and kept talking to other people. And I just felt the sort of drugs are more aimed at the symptoms rather than the cause. Because actually, if you can treat the cause, hopefully you won't need the drugs for long term, depending on the type of problem it is.
Yeah.
But that's a much better approach.
Yes.
And trying to deal with mechanical issues, weaknesses, alignment issues, muscle tightness, joint stiffness. That, to me, that makes a lot more sense.
Yeah. So decided that you kind of want to move into this field. A lot of university training, not.
Yes, it was. So I finished my 3 years of chemistry degree. So there's a certificate up here somewhere.
Yes.
And then I did 4 more years at Willmott doing a Masters of Chiropractic. So essentially 3 years of theory.
Yep.
That same 3 years that is quite similar to what the doctors do.
Yeah.
And then 1 year in the clinic down there treating. So practicing your hands-on skills, getting the tutors in to check, you're all okay.
Yeah.
Getting a certain number of people and treatments, and then obviously passing exams and qualifying.
Yeah. So then qualified, what's next?
Yeah, so I from Bournemouth, I moved back here.
Yeah.
So my family come from this area.
Yeah.
And then I worked for about 3 or 4 other companies, I guess learning the ropes.
Yes.
And then after a while, I thought, right, I'll give it a go myself.
Yeah.
Rented a room at the dental surgery up the road.
Yeah.
From 2017 to 2023.
Yeah.
And then we moved here. So we've been here 2 years now.
Yes.
Really. And in the last 2 years, we've gone from a team of sort of 1.5 to 6 practically.
Yeah.
So, I think that just shows me, it was a bit of a risk, but that shows me that the demand is there.
Yeah.
And it's trying to educate people about, certain problems, back pain, neck pain, headaches. You don't have to live with them.
Yeah.
You can always get an opinion, get it checked.
Yeah, absolutely. Because one of the bits, I know you mentioned it there, one of the bits I always found really surprising is that I suffer from migraines, and actually having, treatment, and more so when I was coming a lot more kind of routinely, before life got a bit crazy and I've been a bit backseat with it, it can really help with that. And it's interesting that, you wouldn't think that perhaps, having an issue or having an issue like migraines and then coming in for treatment that side can actually work at treating it and kind of preventative.
Yeah, absolutely. I mean, again, there's lots of different types of headaches, but primarily if you're talking about tension type headaches, so from just tight muscles around the neck and the head, cervicogenic headaches, there's a bit of stiffness within the joints of the neck as well. Migraines to an extent, I mean, they're still quite complex, but certainly for a lot of migraine sufferers, we see a good improvement in terms of sort of less frequency of headaches and less severity. So you may still get them, but to a lesser extent.
Definitely.
So again, it helps to sort of manage some of those conditions as well. Plus, it all depends on the triggers. If you struggle with poor posture or stress, that puts a lot of tension up here, and you find some people come in and almost their neck's disappeared. So the looser we can keep that, the better. But you're right, in the beginning, you need to do a few more sessions just to kind of get you up and running. And then it's just a little MOT every once in a while. See, life's busy. And everyone slouches. You know, it's not, even me at times. You can see a lot of people, I think, if they were aware there's a service like this, that it would benefit them. Absolutely. Yeah, there's so many people working, but worst one is working on laptops on the sofa. Literally like this. And they rub their neck, nothing, and then, I've got a really bad headache or something's crept in. So there is still a large proportion of educating people, people what to do, what not to do, if they want to self-manage, but if symptoms persist, to like consult someone. Don't just leave it, and keep taking ibuprofen, Nurofen week in, week out, year in, year out, which we find some people do.
I remember when you were at the dentist down below, and kind of the transformation is really crazy. I mean, in terms of kind of how quick you guys have grown, which I guess is probably testament to some of the support from the community. I know before I came, I had a quick look, and the amount of 5-star Google reviews has really kind of shot up from where it was. You now went over 200 5-star reviews. Is great. I mean, is it largely support from the community, I guess?
Massively. Everyone locally has been so supportive, here from the Takeley Silver Jubilee Hall up to the guys for the Dunmo soapbox race. We've got a lot of contacts in Bishop Stortford. That's where I grew up as well. But I think for a while I was nervous to ask people, but I think as we've evolved, we said, do you know, if you've had a good experience, if it's helped you, would you mind leaving a Google review? And so far I think they're 205 5-star reviews. So, I mean, I'm really grateful to the guys locally, because again, it's lovely that we can help them, but they've also helped us grow as well. And I think by coming to a bigger space, we've managed to grow the team, so we have more appointments and availability. So it's just getting the word out there that there's a lot of things we can help with. But locally, everyone is, it's great. I really appreciate their support.
For sure. So there's 6 of you now? Or
there's 6 from, a couple of weeks' time.
Okay. So new person starting? And
absolutely, Okay. So then we'll be even split. It'll be 3 boys, 3 girls. That'll be good. Nice. But then obviously the new girl can do some cupping as well. So our services are increasing as well. So, it's pretty, so it's kind of like almost a one-stop shop. So if you're not sure what kind of treatment you may need, you can come in, have a chat with one of us. We might say, see the chiropractor first, or see the sports massage therapist first, or we can inter-refer. So try and give you like a tailored plan, if you like, and what's going to be best for that individual.
So when you're not working here, Scott, what is it you like to tend to do in your spare time?
Well, I mean, I try to get down the gym twice a week if I can, and then looking after our 2 dogs and our 3.5-year-olds. So just tiring them out, and myself pretty much.
So enough to keep you busy then, which is...
There's no rest. No, then I come here for a bit of a rest, to be fair. But it's all great,
Nice. Good. And I thought I'd finish off with a couple of quick fire questions. Myth or fact? So I've suffered a bit that I guess sometimes there is a misconception on. So I'll grab my list. I'll kind of reel through them, and then perhaps you can kind of answer and let me know the answers.
Absolutely.
So chiropractors only crack backs?
Myth.
Okay. Can chiropractic care actually help with headaches?
Yes, if there's some research out there if you want to read it. But absolutely, and you're testament to that as well. Brilliant.
If it doesn't hurt, you don't need to book. If it doesn't hurt, you don't need to book a massage.
No, I think everyone benefits from a massage. A lot of people we find are out of alignment even before they come in, to be fair. So sometimes that's a precursor to something happening as well. So, I mean, I would say still most people will wait till there's a problem, but you don't have to. You can have like a little check just to make sure if you want to.
Okay, cool. Does massage therapy actually reduce stress hormones in the body?
Well, you have to speak to my colleague for that. That's our massage expert.
Yeah.
You can have a chat with her in a minute.
Sports massage is only for athletes?
No, anyone can have a massage.
Yeah.
But again, ask the expert.
Yes. And the last one, chiropractic is dangerous.
No, not at all. Not if you're trained properly and you're doing all your screening checks. That's why we'll take blood pressure, reflexes, check all the nervous system, and then you pick and choose your treatment based on what you've got. And if we can't treat someone or we're worried about something, then we'll refer out to the GP or for imaging. So yeah, you're in safe hands. Yeah.
Perfect. Well, I have a couple of questions that I want to know, obviously about the kind of massage side. Heather's the expert on that.
Yeah,
Have
absolutely.
a chat with her?
Yeah, go for it. Bring her in.
Lovely. So thanks for coming in, Heather. Scott's asked you to come in as a dedicated massage specialist.
Thank you.
I know, obviously, massage is such a really kind of broad term, and so many different components of that. I mean, when you say massage, what actually do you offer for those that don't know?
We have a range of massage services. So initially we were looking at more sports deep tissue massage, but I also have qualifications in reflexology, Indian head massage. So we do that. And more recently, I've done a qualification in lymphatic drainage because it became obvious from some of our clients who'd had operations, they've trusted us to work on them. And, we don't want to go somewhere else. We know you're a dedicated team. So,
Nice. And in terms of those people that are, coming over to see you, because I wouldn't know if it was me, what massage I would essentially need. Is that something that, you can advise on from the kind of consultation side?
Yeah. People can either contact us, sending us an email on the info at Takeley Chiropractic address, or contact us on Facebook. Or they can give us a call and we can run through what might be a fit for them. We do tailor the treatment to suit the clients. Okay. So I have some clients who have a combination of Indian head massage and lymphatic drainage. It just depends on, meeting the needs of the individual clients.
Yeah, absolutely. And in terms of, so I know you mentioned it there, and it's one that I'm really curious on.
Yeah.
Lymphatic drainage.
Yeah.
What actually is that? Because I've heard of, Indian head massage. I've heard of the kind of sports massage, but that's one I've never heard of.
Yeah, the lymph system follows the circulatory system and it clears out all the rubbish out of the tissues.
Okay.
If you've had a virus or something, sometimes things get stuck and the lymph system doesn't clear properly. It doesn't have a pump.
Oh, wow.
So then you're helping clear the toxins out of the body.
Wow.
So it takes a while to, so,
and
it helps if people are feeling foggy. If they're feeling clogged up, we sort of work around the head. So it's effectively working over the sinus regions, over the head, down the whole body.
Yes.
So it's very slow massage. It doesn't use any lotion.
Okay.
And I even had someone snoring away the other and they came into one. So I guess it was very relaxed.
Yeah.
And obviously I'm treating a range of people of men, women, kids, so of all different ages. So I think that's the nice thing here. So myself and Tom at the moment that do the massage. Tom also does chiropractic. So at least we've got more than one person. So.
Absolutely. And one of the questions that I asked Scott, which I guess I'll ask you as well, with any kind of treatment, is it best to, I suppose a lot of people might wait until they've got an injury to kind of come and see you, or they've got some aches. Is it good to kind of keep up like a regular?
Yeah, I mean, I have a number of clients who've been coming in to see me for a number of years. Obviously, the business has been going for 8 years, and some people have been coming in regularly, maybe once a month, once every couple of months, once every 3 months, depending on what suits them. And they'll get to a stage of saying, I knew I'd gone that week too long because I started to stiffen up. But it means they're maintaining things. They're not getting to the point that they're in agony, which they were before they actually found us. So
And in terms of, the word sports massage, is that something that's kind of reserved for just people that are doing sports, or can anyone have that?
Anyone can, because you put a caveat, it's sports deep tissue.
Yes.
Basically, I adapt it for the age of the client, whether they've got any other injuries. So I wouldn't go gung-ho sticking my elbows to trigger point people's shoulders if they were, say, 80. We adjust it. It would be a more gentle massage.
Right.
But it's so great to make a difference for people. If they come in, they can't turn their head from side to side. And they leave here being able to move more freely.
Yeah, absolutely.
And you look at people and think your eyes are more clear. So it really makes a difference.
So it was one of the ones that I picked up from looking at, your Google reviews and kind of doing the research and advice to coming here, so many people say that, you know, from leaving, they feel so much better than, you know, they did coming in, which I guess is obviously really rewarding for you guys as well.
It's really nice. And, you know, so people go, oh, I feel all relaxed. I feel like jelly. And it's super. It's really nice to make a difference.
Yeah, no, fantastic. Lovely. Well, thanks for having a chat with me, Heather. Obviously, you know, for those of you that haven't been down, I suggest, you know, come down. The team here are obviously super friendly. And yeah, be too happy to help.
So this is our bit of kit, the MSK Analysis Pro, or we call him Mac because it's a lot easier. This was behind us when we were recording earlier, but this is what we do a lot of our postural assessments with. So we've got weight sort of each side, so you can see how much weight's going through each foot. So we can see here there's 52.1 kg on the left and 54.6 on the right. So we know there's a slight discrepancy there, a little bit more pressure on that right-hand side. And then the strings will line up with various points of the body. So we'll just line them up through here. So that's that one. So the yellow is where it should be, and the red is where it is. That's it. And we'll do the same with the shoulders. And this will highlight any imbalances there. And it's been a little while.
It has been a while.
Been in, so MOT needed. Been working too hard recently. That's it. And do the middle one. So we can see it's slightly out.
I'm nervous to turn around in case it's
a little bit of a forward head carriage, but again, you work on the computer a lot of the time. But yeah, so I say you probably due an MOT. Based on that, but you can have a look.
Oh wow! So the red is where
red is like bad, if you want to think.
Oh, fine.
Okay. Red is where it is, and the yellow is where it should be.
Okay. Fine.
So lower back definitely needs adjustment.
Lower
but
back
again, that pelvis being out, because I know for you stand on one leg a lot more.
Sometimes, yes. Yeah.
A lot of the time. We've told you off about that. But again, that just puts more weight that side. Pelvis gets a bit stiff. So it's not to say you will definitely have pain, but it's a good time just to get an MOT. It's been a few months anyway. Just
absolutely.
Keep it ticking over, really.